a bit about the anatomy and physiology, and onto the pathologies, the sphincters and the lining of the stomach, and all of those things that can go wrong. We're going to start with a scenario. Your professor, me, JG, loves eating peppermint patties. The dark chocolate has been shown to improve cognitive abilities, improve your brain power. And the peppermint, the smell of peppermint improves memory. So I thought it was the perfect food. The problem is eating too much and you start getting these side effects of inability to sleep and severe acid reflux disease. So which part of the peppermint patty causes both insomnia and acid reflux or heartburn? The answer is chocolate. And specifically, the chemical in chocolate is theobromine. It's very similar to caffeine. It increases the heart rate, causes insomnia, inability to sleep, and it also creates GE or gastroesophageal reflux or heartburn. The theobromine in chocolate is actually higher in the dark versus light. And the other substances that cause insomnia and reflux are coffee, of course, caffeinated drinks. All of these things increase reflux and insomnia. So let's go on to the sphincter names. Within the stomach, you have two sphincters. The upper sphincter is called the either cardiac, gastroesophageal, or a lower esophageal. So it has three names. The sphincter to the outlet of the stomach going to the duodenum is called the pyloric sphincter. Esophageal reflux is when acid is allowed to go up into the esophagus. And other causes of esophageal reflux besides the chocolate can happen in pregnancy, obesity, causing actually increased abdominal pressure, overcoming the pressure of the sphincter. Anesthesia can cause it. In some people, gluten can be a problem. And of course, alcohol. All of these things can cause acid reflux. So a hiatal hernia allows acid from the stomach to get into the esophagus. What structure normally prevents this from happening? The diaphragm or the cardiac sphincter? So the answer is the diaphragm. If this opening from the diaphragm down into the abdominal cavity is too loose, it can allow the portion of the stomach to go up into the chest. So it's actually considered a structural defect in the diaphragm. It's just too big. The treatment of a hiatal hernia is called a Nissen fundoplication. It's where the stomach is brought down below the level of the diaphragm, and the fundus of the stomach, or the top of the stomach, is wrapped around. So it creates a wider, instead of making the opening smaller in the diaphragm, it makes the top of the stomach actually larger. So it's called a Nissen fundoplication. And usually this is done laparoscopically. Okay, let's go on to another medical scenario about the stomach. You've got your cousin who tells you he has a history of stomach ulcers. Now, ulcers are when you start seeing these erosions of the stomach lining. Next question. Because of his ulcers, he said he avoids all acidic foods like tomatoes. Is that scientifically sound advice? The answer is no. This is the pH scale of stomach acid in comparison to foods, water, bleach, all the way up. So stomach acid has a pH of between 1 and 2. Stomach acid is strong enough to dissolve teeth enamel. And for people that have a problem with a lot of vomiting, like during pregnancy, this can start dissolving teeth enamel. Stomach acid is much more acidic than any foods you can eat. Look at this scale. Tomatoes are 4. Stomach acid is around here, around 1. So the stomach is an amazing acid pod. It contains the acid. It mechanically breaks down food. And it has the ability to keep the acid from digesting itself. And then the acid allows the protease enzyme to begin the digestion of proteins. So let's talk about pH a little bit more. So the more acidic, the lower the number. So what does the term pH stand for? Percent of hydrogen ion, potent hydrogen ion, or the power of hydrogen ion? So the answer is it's the power of hydrogen ion. So an acid has more hydrogen ions compared to a base. On the left side, an acid has a high concentration of hydrogen ions. The actual number is 0.01 moles. And it's in this equation where you can shorten it to 0.01 equals 10 to the minus 2. So in contrast, a base has very few hydrogen ions, has many more zeros behind the decimal place. So instead of writing out all of those zeros behind the decimal place, it's shortened to 10 to the minus 9, as in baking soda, 10 to the minus 9. So this creates a logarithmic scale, and it makes it so you're able to see the number without having the zeros. pH is equal to a minus log of the hydrogen ion concentration. And when you write out this formula, pH of minus the log of 10 to the minus 2 equals 2. So the two negatives cancel each other out, and you end up with a pH of 2. So let's look at the coffee. What is the pH of coffee? It's got 0.00001 moles of hydrogen ion concentration. Does it have a pH of 1 or a pH of 5? Answer is it's a pH of 5. It's the number of zeros behind, or the number of zeros and numerals behind the decimal place. So here's coffee, pH of 5 right here. Stomach's all the way down here at 1. Everything else has a lower concentration of acid than stomach acid. So if gastric acid will destroy the lining of the esophagus, why doesn't the acid destroy the stomach lining itself? Is it A, goblet cells secrete a protective mucus, or B, the stomach is lined with keratinized cells? The answer is you have special goblet cells that secrete a protective mucus lining. So they produce mucus and a little bit of bicarb. So you have this layer of mucus, and here's a stomach lumen, the middle of the stomach with a pH of 2. So these goblet cells are incredibly important to protect with your stomach lining. Now we'll go into all the different ways that you destroy your poor goblet cells. Well, first of all, I'm going to talk about how eating stimulates the gastric acid production, and it does it through the vagus nerve. So as you eat, food stretches the stomach, stimulates the vagus nerve, cranial nerve 10, and that is the parasympathetic arm of the autonomic nervous system. And this is a review of what we talked about when we went through the nervous system. But this puts you in the rest and digest mode right here, eating, rest and digest, cranial nerve 10. So now we're going to talk about goblet cell failure and how you destroy your goblet cells. So symptoms of gastritis, ulcers, pain, heartburn, nausea, vomiting. And all of this is from goblet cell failure. The common assassins that can hurt your goblet cells are things like aspirin, Motrin, Aleve, all of these non-steroidal anti-inflammatory drugs. Alcohol, nicotine destroys goblet cells. And of course, this H. pylori, Helicobacter pylori, is a bacteria that goes into and destroys the lining of the stomach. So they all hurt your goblet cells, but they do it by different mechanisms. So H. pylori, the bacteria goes in and erodes the lining, kills the goblet cells that way. Alcohol does as well. Nicotine in tobacco is a direct vasoconstrictor. So the mucus cells are not getting a good blood supply, and it kills off the blood supply of the mucus cells. And the medications, aspirin, non-steroidal drugs, inhibit prostaglandins, which stop the goblet cells from producing mucus. So it's not that you, it's not the direct action of a Motrin tablet that lands in your stomach causing an ulcer. It's an actual effect of the medication getting into your bloodstream and inhibiting prostaglandins in goblet cells. So you can have an intravenous injection of non-steroidals like Toradol, and that will knock out goblet cells and create an ulcer. Okay, so let's do a case presentation. This is Spicy Uncle Pete, and he has gastritis. He believes that his spicy foods are causing his gastritis, but he loves his hot peppers so much that he decides he'll eat them anyway and chase it with Motrin and Mylanta. So what advice would you give to Spicy Uncle Pete? Would you tell him to stop eating spicy foods or to stop taking Motrin? And I'm hoping you're gonna say that he needs to stop taking the Motrin that's taken away his goblet cells. So gastritis is caused by a loss of that mucus barrier. It is not by increased acid production, spicy or acidic foods. So it's the Motrin that's making his gastritis work worse. So bottom line, always look for the cause. Always look for the root cause. So the treatment of his gastritis would be identifying and eliminating the culprit, coat the lining of the stomach until it gets healed up. If a person tests positive for H. pylori, they'll need to be on medications to kill off that bacteria. And then shut down the parietal cells from producing acid for, up to 2 weeks or so. And once the stomach is healed, the goblet cells are back in order, then they can stop taking these protein pump inhibitors like Prilosec, Nexium. Okay, so let's go on to the next ulcer down the line. This is the duodenal ulcer. Remember, the duodenum is the first part of the small intestines after the stomach. So there are no mucus cells, no goblet cells in the duodenum. So the acid needs to be neutralized by bicarb that's produced from the excretin side of the pancreas. And that should say exocrine side of the pancreas. So next question, look at the location of the pancreatic duct. Where is a duodenal ulcer likely to occur? In A, the first portion of the duodenum, B, the mid portion of the duodenum, or C, next to the jejunum? And the answer is A, it's the very first portion of the duodenum. That's the location of where all the acid is spilling. And if the bicarbonate doesn't get up into this segment, this is where the ulcers can develop. So that can happen before acid neutralization. And this is a depiction of where all the ulcers, esophageal ulcer, gastric ulcer, or duodenal ulcer, at the first portion of the duodenum. So in summary, we've talked about digestion as far as the stomach is concerned. On the pH scale, the lower the number, the more acidic. Your stomach is that acid pot. The sphincters keep the acid contained. And then the stomach has its many challenges with hiatal hernias and the goblet cell assassins. So the stomach has to break down food, chemical, mechanical digestion. It has to prevent autodigestion by producing a mucus barrier by the goblet cells. And then it contains itself with these sphincters. Any questions? Please leave comments, subscribe to the channel. Thank you.